The following video is a story to demonstrate the benefits of direct-to-consumer treatment, sometimes called DTC. The story centers around a mother and child and their interactions with the provider online. When the story is done, there will be a Q&A session afterwards with the provider, who will answer some of the most commonly asked questions about DTC medicine. Please stick around for this valuable information. We thank you for your time. Enjoy the video.
Oh, buddy, I think we're going to need to check in with the doctor, okay? Can I see that for a bit? Thanks.
The patient fills out demographic information in order to populate and create an electronic medical record. They are asked questions about insurance and asked about what symptoms they are feeling today. Once completed, they are placed in a virtual waiting room with a maximum 15-minute waiting period.
Hi, my name is Stacy Petty, and I'm one of the nurse practitioners here with your local clinic. Can I ask who I'm speaking with today?
Hi, my name's Jennifer, and this is my child, Kenny. Hello.
Okay, I can see and hear you well. Can you see and hear me well?
Yep, we hear you loud and clear.
Okay, great. So it's nice to meet you both. I'm sorry that it looks like your little one isn't feeling well. Just want to make sure that you are in a place where you feel comfortable with your privacy, talking with me about what's going on. I am in a place where it's secure and private. You don't have to worry about that. Just want to make sure that you're comfortable where you're at.
Yeah, we're here at our home right now, but this guy isn't real comfortable at the moment.
Yes, I can see that. Oh, I hate it when kiddos don't feel well. Okay, another little thing I want to make sure is, can I get Kenny's birth date just so I can make sure I've got the right chart?
Yep, his birthday is June 21st, 2014.
Okay. Well, something I want to talk with you about is that I am a note taker. So you might see me looking down during our consultation, and that is just me making notes in your chart, making reminders for myself. I am not on my phone or being distracted. I am fully engaged with you in your visit today. Just want you to know that, because I might not have eye contact with you the entire time. Next, it is really bright around you. There's a lot of sun coming in. Could I get you to close those curtains, Mom, just so I could see you a little bit better, please?
Oh, yeah. Here, hang on. Can you hold this, please? Okay.
All right, that looks a lot better. I'm able to see you both a little better. And so, Kenny, why don't you tell me a little bit about what is going on with you today? I can tell that you don't feel well.
His ear hurts. It's been hurting for a few days, and it appears to be leaking some gunk.
Okay. So I hear you telling me that it's hurting, and you're pointing to your right ear, and it looks like there's some fluid coming out of it. Can you tell me a little bit more about that, Kenny? Is it hurting more on the deep on the inside of your ear, or is it more just on this outside? And does anything make it worse? Does anything make it better?
It hurts all over. Ice cream makes it better.
Oh, I bet that ice cream does help. It helps me a lot too. Okay. And do you do any swimming or go to the lake or anything like that, Kenny?
Yes?
We went to the lake last weekend.
Okay. How about any sore throat or stuffy nose, Kenny? Anything like that?
No.
Okay. Is it hard to hear out of that ear that's been hurting you? Okay. And is it hurting in your other ear as well, or just the one?
Just this one.
Okay. All right. So it's just your right ear, and you're okay with hearing, but it is pretty painful, and we've got some fluid coming out of it. So, Kenny, I'm going to need your help. I'm going to ask you to do a few things with me, okay? And some of these might be a little painful. We can always take a break if you need to. So the first thing I need you to do is to push on this part of your ear right here and tell me if that hurts you.
Okay. It hurts.
Okay, all right, that's good to know. Very helpful, thank you. So now I'm gonna have you gently pull back on your ear right here on this low part, and you're gonna pull gently outward. Tell me if that's sore.
It's okay. Just give it a little pull.
Mom, he doesn't have to do it if he doesn't want to. I know it's hard to do that when you are expecting it to hurt. Okay, Kenny, I know that was hard and it looks like that was painful, but thank you for being so brave and doing that for me. Okay, last thing I need your help with, Kenny, and then Mom, I'm gonna need your help too. So I'm gonna need you to take your fingertips and we're gonna gently start behind your ears, Kenny. And we're just gonna gently walk our fingertips down underneath our chin. And Kenny, I want you to tell me if you feel anything that's swollen or hurts when you touch it.
It's a little sore.
Okay? And Mom, what do you feel anything there too?
Yeah, it feels like it might be swollen a little bit.
Okay. All right, that was perfect. Thank you so much for your help. All right, Mom, this one's for you. I'm gonna need a little bit of help. We're gonna need to look into Kenny's throat. So if you can line up his mouth with the camera, and then Kenny, you get to open your mouth really wide and stick out your tongue and say, ah. And then Mom, I'll just need you to make sure that that camera's really close to his mouth so I can see the back of his throat, please. Okay, that's perfect. I can see the back of your throat and your throat doesn't look red or angry, so that's really good. Okay, Mom, how about a fever? Are we having any fever?
Yeah, it looks like 100.1.
Okay, all right. Have you been giving him any medications to this up until now? Anything to help?
I gave him some Tylenol for the pain yesterday and then again this morning. He did have issues with ear infections when he was a little younger, and we had this device. The pediatrician gave us this to monitor his situation. I can hook it up now and see if we can see anything.
Okay, that would be great. That external otoscope's very helpful.
Also, before I logged in today, I took some photos that I uploaded with the device, hoping that maybe they would help tracking the progress of what's happening with his ear.
Okay, yes, that's always very helpful. Thank you so much.
Turn towards me.
Okay, so let's look. Okay, you've got a great placement in the ear. Okay, I can see his tympanic membrane and that's intact and no ear infection, but I can see that the external ear canal is swollen and I know that's very tender to place that in his ear. Okay, Mom, we're good with that. I can see what I need to. So it really looks to me like Kenny's got swimmer's ear. And that fits with y'all's trip to the lake this weekend. Usually that's a simple treatment, just an antibiotic drop that has some steroids.
With the exam information, images, and patient history, the nurse practitioner, Stacy, is able to provide the patient's mother with a diagnosis of swimmer's ear and recommends a course of antibiotic ear drops. Provider and mom discuss potential allergies and medication interactions, how to administer the medication, which pharmacy to send the prescription to, and how and when they should follow up with Kenny's primary care provider.
Should I keep him home from school while he's sick?
So this is not something that he's contagious with, but he is uncomfortable. And so he might not be able to focus at school. So that's really your judgment about him missing school with this. And I'm happy to provide a note for school if you'd like.
I'll probably need something for school. Thanks for thinking about it.
Okay, yeah, no problem. I've got kids too, and I completely understand. So let's just go over what we've talked about here. Sounds like he's got external ear infection, also known as swimmer's ear. We are going to treat him with a drop that has an antibiotic and a steroid in it. We're going to give some of those drops in his ear, the one that hurts, every couple of days. We've talked about how to do that with him lying down. We're going to continue the Tylenol for pain and fever. He can stay out of school if he needs to. If he doesn't get better in 3 to 4 days, we're going to contact the pediatrician. And then if we need to go to an urgent care or an emergency room, that is because his fever has reached 104 and not responding to the Tylenol. His ear canal has closed off with the swelling. If you notice any blood coming from his ear, or if he has a change in his pain, then all of those things would mean that you need to seek some further care, okay? We're also going to send a note to his pediatrician just to let him know that we have seen Kenny and we're treating him for this, so that we'll all be on the same page. And I'll send that school note through your MyChart just in case, you guys decide to use that, as well as some education on swimmer's ear. And it will include some things you can do to prevent it next time you guys go to the lake. Do you guys have any questions for me?
Yeah, I'm kind of curious. How can we prevent him from getting swimmer's ear again in the future?
So just keeping those ears dry as possible. A lot of people you will see wear those little earplugs or the swimmer's cap. You can also put some drops in your ear that help dissipate the water afterwards. But that will all be in that education that I send to you afterwards. And hopefully those will all prevent those from happening again, because I know that, Kenny, this is not a pleasant experience for you.
Okay, thank you.
You are so welcome. I hope you get to feeling better soon, Kenny. And Jennifer, please don't hesitate to reach back out to us. And thank you so much. Hope you guys have a good day. And if you guys will just push the red button on your screen, that will end our visit and I will go away.
Okay, thank you.
All right, bye-bye, y'all.
From a provider point of view, what are some of the challenging elements of direct consumer delivery?
Well, we in our program are lucky because it's an on-demand and this is all that we do. So we're very lucky in that aspect. However, I feel like providers that are in a clinic setting and are trying to juggle seeing patients in person in clinic and then trying to fit in telemedicine visits as well, that could probably be pretty demanding going back and forth. Also, I have heard from other people, and I can imagine having been in a clinic setting before, that if you don't have a facilitator there to help you with those visits, helping confirm appointments, getting online when the patient is scheduled and letting them know that yes, that someone on your end is also there, so that they're just not sitting there and waiting and just wondering if they've done it right, is someone coming? I think having that facilitator is a big portion of making it a success when you're in clinic. Also, I've heard from my peers that segregating their telemedicine time from their inpatient time really helps, so that they're not seeing a person in clinic and then having to run and get on screen for their telemedicine appointment and then go see another patient in clinic. If you can separate that time, that's really proved to be helpful.
What are some of the challenging elements of DTC delivery from a patient's point of view?
So I would think technology is the biggest one. And I don't necessarily mean in being able to connect to us, but for some patients, they don't even have an email address. So if we need to send them information, or if they want to send us a picture or a blood pressure log or things like that, being able to tackle the other challenges outside of the visit for information sharing can sometimes be a challenge. So this is another part of the visit that is not exactly when you're online, but that the facilitator in your clinic could definitely help with. Because, as a provider, I don't have an extra 15 minutes to help them figure out how to email a document, but that facilitator could. So it's just those other little things that you might assume that everybody has the email or is comfortable knowing how to share information by taking a picture on their phone, things like that, but not everybody is. So I've found that to be a larger issue than actually being able to connect for the visits and complete the visit.
What devices do you wish the patient had at home for direct-to-consumer visits?
We see a lot of kids, so the otoscope is invaluable for us. Also, I think An easy to use stethoscope like device would be invaluable just for hearing breath sounds. A lot of times we have a lot of asthma in adults, cough, things like that. We can usually assess rashes and skin issues pretty well just using the camera that the patient has access to. In some cases, a derm scope would be helpful, especially I would think if like dermatology is your thing. But just for general practice, I would say a stethoscope and then an otoscope would be great.
How could a provider accurately assess patient vitals from the home?
We use a lot of the tools that patients already have at home. You'd be surprised how much a smartwatch can tell you. We use that a lot for heart rate. Some of them even do pulse ox. A lot of patients now have a home pulse ox, which we utilize, home blood pressure monitors. Even if the patient just holds it up to the screen so we can see the numbers and the trends. We like to see the trends, obviously. Patients can also take pictures of that and send it into our service so that we're able to track that. And then some of the smart devices also will do an EKG pattern. So those aren't necessarily fine tuned yet, but sometimes we'll take a look at those if the patient has it available. And we also utilize the patient in trying to help us do our hands on part of our assessment. So that might be showing them how to check their lymph nodes or having them make certain movements if it's a sprain or a strain that we're assessing for. So we always try to use any tool that we have available. And most of the time that includes the patient themselves, and they seem to really appreciate it and like it, and it makes them really feel involved in the visit.
What has surprised you most about these sorts of visits?
So, two things. One, I kind of thought that this would be impersonal. These visits would not be as warm and fuzzy as an in person visit is. I like to be hands on with my patients. I'm a toucher, I'm a feeler, not just in assessment, but I tend to have a physical connection, warmth that I like to establish in person visits, as we all do, I'm sure. And I felt like that could be missing from this platform. But I've been really pleasantly surprised. If you really try to establish that connection with your patient, making good eye contact, involving them in the assessment, and just communicating with them in a way that they can understand, asking more questions, noticing little things about them or their home or what's going on around them, making it personal. In the video, you hear me mentioning, oh, I've got kids too. I totally understand. Just show them that you're a normal person just like they are, and you're not just somebody on a screen. So that is the biggest surprise. That, and I tend to be a little more efficient, and I'm able to kind of focus in on the visit when I'm here online versus when I'm in clinic and I'm hearing what's going on in the next room with the patient or hearing patients come and go in the hallway being checked in or checked out. I find that in this format, I'm able to just kind of focus on my patient that's right in front of me. I don't have that extra sensory input coming in, and so I find that I'm a little more efficient.
Thank you for watching this direct-to-consumer video toolkit. You can find more video toolkits and related resources linked below. This video and other video toolkits in this series were made possible by funds from the Office for the Advancement of Telehealth, the Health Resources and Services Administration, and DHHS, and in collaboration with the California Telehealth Resource Center and the South Central Telehealth Resource Center.